All right, so here we are now. We're going to talk about examination of the wrist and examination of the elbow. And this becomes a really important thing. There are different kinds of injury patterns. I'm going to stick to, again, some of the more common. But as is the case with each of the things we're talking about in this book, any of these is really grounds for an entire book in and of itself. So we're just going to review the major things I want you to look for. So we're going to start by talking about the elbow exam. And young athletic kids often have elbow injuries. They have both acute traumatic injuries and overuse injuries to the elbow. So the history and the physical exam become very, very important things when we talk about wrist and elbow injuries. So what are some of the common injuries we see in the elbow? Well, in the overuse injury setting, it almost is always from throwing. Hey, doc, you get a call. I'm having trouble throwing a baseball because my elbow hurts or my kid's elbow hurts. I really am very careful with those, and I want you to be too. If you get a phone call that somebody's having trouble doing their sport because of pain anywhere in the body, in this case the elbow, I want you to take that very seriously and pay very close attention. Now, acutely, we also see falls that often result in elbow injuries. The snowboarder who lands on an outstretched hand, who comes in complaining of pain in the elbow, again, you want to be very careful with that. What about in the wrist? Well, there are all kinds of wrist injuries, but we're going to talk mostly today about acute traumatic injuries to the wrist. Again, this is the kid that lands snowboarding or playing soccer on an outstretched hand. The fall into an outstretched hand mechanism is a very common one. You land just like this, and I'm going to show you how to look for some of the different problems we see with that mechanism. So with that, let's go through the wrist and elbow examination. And like all things, as I mentioned, it starts with the history. We've taken a history. Now let's go through what we're looking for. So we're going to examine Max's right elbow. He's going to sit up here, and he's going to give us a big smile. Make sure he's got teeth. There they are. Good. We're going to have him bend his elbow all the way up and all the way out. And just have your hand just like so. We're looking for, first of all, the elbow joint should have almost full 170 degrees or so flexion and extend fully. Now, he can do that on his own, active flexion. Go ahead and do that. And out. And if I'm worried about this, I will sometimes check with passive flexion to see sometimes the muscle's a bit tight. I want to see if there's a hard endpoint. But usually you shouldn't force kids' joints into doing anything they don't want to do. And so active motion is a much easier way to do this. Next, we're going to check the other function of the elbow joint, which is pronation and supination. He should be able to fully rotate his hand, almost fully in each direction. So we're going to bend his elbow just like that. And go ahead and rotate your hand all the way over one way and the other way. Good. I sometimes will actually put a pen in my patient's hand to check side to side. Go ahead and turn it the other way, all the way over. And the pen should at least be horizontal on both ways. You can see he's got even a little more pronation, which is fine. But as long as he can get that over both ways, that's fine with me. So once we've identified the range of motion, full flexion, extension, pronation, supination, let's look at some of the important landmarks. Well, the key thing in kids under the age of 13 or 14 is we're looking for pain here. This is the medial epicondyle. I'm going to push on this with my finger right here. This is a cartilaginous growth plate. Again, this is an apophysis, meaning the flexor muscles of the forearm as well as the ulnar collateral ligament both come off of this area right here. What that means is as kids get stronger and stronger, there's more of a pulling force on this apophysis. Little league elbow means your elbow hurts when you throw. And in kids under the age of 12 or 13, that's generally a pulling injury right here at that growth plate on the inside part of the elbow. Now we're going to flip over and we're going to find the top of the radial head here. This is the radiocapitellar joint. Here we have the capitellum of the humerus. This is the top part of the radius. The radial head is here. And we're looking for any pain in this spot. I'm going to pronate and supinate his arm, and if that bothers him, that makes me worried about an injury in this radiocapitellar joint. Now in throwers, we can see both of those, pain here or pain here. They're both serious. And so it's important to remember that if you're examining a kid's elbow, you're looking for discomfort in any of those two places. Just a side note, we do see sometimes pain just in the top of the radial head. Now I know many pediatricians are comfortable with nursemaid's elbow. Remember that if they're kind of 12 years and beyond, if they land on their hand, we sometimes see a fracture of the radial head with this mechanism.